Hello everyone. Let me just hope that you are okay. So today I'm coming with the more interesting topics. But before we go any deeper, uh, we can just ask ourselves that did you know that the patient can be in shock while their blood pressure is still normal? That's why recognizing the early signs and symptoms of the shock can save the patient lives. So, by the end of this video, you will end up with having knowledge about the introduction of the shock and their classification. There is a broad classification and other classification that are included in that broad classification, and to see the clinical features of the shock, what is the sign, what is the symptom, how can you manage it while you are in health center, while you are at the hospital, while you are at everywhere. You can just support the patient who's suffering from the hospital until the patient is getting the life. So, and this video, it is most important and grateful to everyone who is uh, interested in health sciences. So, by starting, we can start by the introduction of the shock. The shock, it is the life-threatening condition in which the circulatory system fails to deliver adequate oxygen and nutrients to the vital organs. That leads to hypoxia, even organ dysfunction, and if it is not treated, it can lead the patient to death. So, by going any deeper, you can just see about the classification of the shock. There is a broad classification of the shock. One of them, it is the distributive shock and the non-distributive shock. So, by going in the distributive shock, this is occur when the blood vessels dilate exclusively, causing the blood to distribute abnormally. So, although the total blood volume may be normal, uh, the effective tissue perfusion will be changed due to the change of the uh, blood vessel diameter. So, about this distributive shock, it is related to the vascular change. If their vessel diameter they change and become moderated and more permeability, even if there is normal blood volume, they will not perfuse not perfuse adequately due to the high diameter. And if there is high diameter, the pressure of the blood will be reduced. When the pressure in the blood will be reduced, they will decrease the supply of the blood into the different organs. So that is the first one. The second one, there is what we call the non-distributive. But before we go into the non-distributive, we can see different uh, classification that is included in the distributive. So in distributive, there is what we call septic shock. There is what we call anaphylactic shock. There is what we call neurogenic shock. Those shock, they are included in distributive shock because from the beginning, septic shock, this is the shock that is occurred due to the infections or can be occur in the blood vessels and cause the dilation of the blood vessels due to secretion of the biochemical mediators. Those mediators can cause the more permeability and more leakage of the fluids in the blood vessels and reduce the more blood perfusion. So in anaphylactic shock, this is the allergy that occur in the blood vessels. Those blood vessels, they cause the different reactions. After being there, they dilate of and they change the diameter of the vessels and alters the normal distribution of the blood. Then there is what we call neurogenic shock due to the injury, like if the spinal cord is have if the person have the injury of the spinal cord, this injury it can cause the inflammation. After being having inflammation, it will cause having the swelling of the veins, even the arteries, even those circulatory system, they will swell. After being swelling, okay, let me jump on the non-distributive. So the main key concept, the difference between distributive and non-distributive. In a distributive, as I told you before, it depends on the vascular change of the diameters. But this one, non-distributive, it deal with the blood volume loss. If there is a blood volume loss, that type of shock, we call it is distributive. So how it is, this is include the all form of the shock not caused by the abnormal or blood vessel distribution. So those are all types of all classification of the shock that not depends on the abnormal blood vessels. So it depends what it is the result from the either loss of the circulating volume or pumping failure or obstructive blood flows. So at least it is just caused by the um, circulating blood volume loss or pumping failure or obstructive blood flow. Why this one? Because in you have the normal blood vessels, and inside the normal blood vessels there are low amount of the circulating blood. So this circulating blood which become low means the nutrients and oxygen also it will be low, then cause the organ to be suffering from that lack of the nutrients and the oxygen. So in cardiogenic shock, when the cardiac or heart is fail to pump those blood to reach in the brain or other vital organs, those organs will suffer from the lack of those nutrients and the oxygen. So obstructive shock, like if there is the mechanical obstruction in the pulmonary blood vessels, their obstruction like embolism attacking there, they will cause and pumping the blood to the pulmonary, and the body will suffer from the having low oxygen due to there is no diffusion taking place in their lungs. Means there is no gas exchange that is occurring in their lungs. So then those are three types of non-distributive, which are hypovolemic, cardiogenic, and obstructive. And the other types of the non-distributive, it is the anaphylactic, there is neurogenic, there is also septic. Those are the type of the shock might be included there. So these are the difference. So without delay, just we can continue by the normal cellular function. Before having a shock, how their body cells they working together. So this, as normally the cell have the mitochondria that produce ATP. So the energy metabolism occur within the cell where nutrients can be broken down and stored in the form of ATP, which is adenosine triphosphate. Those energy help us body to perform different functions like muscle contraction, like biochemical synthesis, like different organs like active transport. Those energy they help them to perform the cell function. So but this way of the metabolic can be aerobic or anaerobic. So means if there is a metabolic by aerobic, means there will be production of the energy, which is glucose, and also we produce the what we call water. So sorry, we could produce what we call oxygen. So for here, according to the equation, but in anaerobic, when there is a metabolized, it will produce the lactic acid and other toxic substances that can be transported into the liver, and the liver they convert them through they produce what we call glucogen and glucose from that lactic acid. Okay, so this is the normal physiology of the cell. Means they start from the cell, they metabolize and produce energy and store in the form of the ATP, and after being produced in ATP through the anaerobic or aerobic. So if there is any alter those process, it produces the problem. So how this can be altered? About the pathophysiology of the shock, firstly, there is what we call inadequate of the nutrients or oxygen. So the pathophysiology of the shock, we have it starts at least the different steps that will be included for in this process. So without delay, the one among the first pathophysiology of the shock, we can see the first one type of the shock is what we call initial insert. Initial insert means what? In the shock, the cell will lack of adequate of the blood, adequate of the nutrients due to heart failure, due to infection, due to allergy or spinal injury. So the second stage, it will be decreased tissue perfusion. If the heart is being failure, if the blood vessels is being reduced, so the following is to reduce blood flow in tissue and decrease oxygen delivery, which will produce what we call ischemia. So and cyanosis, if there is no oxygen is there. So in case of anaerobic metabolism, if there is no oxygen, the energy will be metabolized through the process of the anaerobic. This process of anaerobic will cause what? Will cause increase of the toxic and the metabolic acidic, which will increase the body to have the metabolic acidosis. So many times the patient who have a shock, sometimes they have the metabolic acidosis or metabolic alkalosis. So by there, the patient body, they try to compensate for that metabolic acidosis due to increase of the lactic acid and other metabolic acidosis. So this, it will be facilitated by the lungs. Lung will be increase of the high breathing in order to remove those carbon dioxide inside of the body and inhale the oxygen, which will support for the body to have alkalosis. So this, it will cause the nutrients being lost and having the intracellular environment nutrients also will be lost. This change, they will change normal functioning of the cell. The cell will just swell due to having the low. After being swell from the difference, maybe infection, maybe injury, maybe whatever, it depends on the cause of the shock. So after being swelled and become more permeable and cause electrolyte to shift from the cell to outside, maybe outside or inside, maybe from the one compartment to other compartment. So this will alter sodium potassium pump, which will impair and damage the different part of the cell. And if when the cell is damaged, so the body function will be lose the capability to perform their function. So other step will be cellular hypoxia. There's being lack of oxygen, with the body will suffer from having oxygen. So there is what we call compensatory mechanisms. If the body recognizes that they have the lack of the oxygen and nutrients, the brain will command to release those measures that will rise up the blood circulation. We are going to see different measures like respond to the sympathetic nervous system, renin, angiotensin, hormones. Those they help to increase the blood pressure. Even there is ADH release or adenosine, which is is the antibiotic hormone. So and the other is progressive shock, which will be if there is no treatment, the shock will be rise. We are going to talk it, and there is what we call irreversible, which is the last stage of the shock, which is letting the patient to live. So from here, we can jump to the, before going on the shock, we can just take notes about the blood pressure regulations. So because this shock comes from the blood pressure fail. If the blood pressure fails, and means there is no circulation will be circulating in the organ. So before going in deeper, there is three main components of the blood pressure or circulatory system. So the first one, it is what we call blood volume. Is the first component of circulatory system. Second one, it is the cardiac pump, which can be helped to pump the blood, and the third one is the vasculature. This vasculature is classified different categories. It can be classified in the arterioles, in venules, veins, arteries, capillaries. Those circulatory systems, circulatory vessels that help blood to reach different organs. It is what we call vasculature. So this blood volume, cardiac pump, and vasculature, they work together and they complete what we call circulatory system. Okay. Firstly, this response may be effectively when they working together. So it is effective due what? Let me just start from the blood volume. Blood volume, it is the one which help blood pressure to be raised or low. So there is a neurochemical produced when the blood pressure is low. There is a neurochemical produced. Those neurochemical it produced, it just improve it depends on the cardiac output and the peripheral resistance. This the main blood pressure regulations we see on the cardiac output and the peripheral resistance. If it is balanced, the blood pressure will be go in a definite condition. But if the cardiac output is low and peripheral resistance is high, means the blood pressure will be low. So that's why it is not, when it is not balanced, it becomes a very serious condition. So when we are going to see the blood pressure regulation, we see what you call mean arterial blood pressure. So this mean arterial blood pressure, it is the one which helps us to determine if the blood pressure is normal, is in a good condition or not. The blood pressure, it is determined by the what we call mean arterial blood pressure. So mean arterial blood pressure, mainly we see cardiac output and peripheral resistance, as I said. So cardiac output, this is determined by the volume that is ejected in a systolic way. When the systolic contract, those blood eject from the heart to outside of the heart. Those what we call cardiac output. So the quantity of those cardiac output, if it becomes low, means the heart cannot be, maybe heart is not able to pump those blood, or even the blood volume is low. And the peripheral resistance, if peripheral resistance, it is just diameter of the arterioles and veins. So if the diameter they increase, the peripheral resistance will increase. So there is no well of the blood perfusion. So we can continue. So about the map, it is the average of pressure at which blood moves in vasculatures. This is the pressure needed to make blood circulate in the blood vessels. So blood pressure, when the blood pressure is low, or when blood volume is low, blood pressure will be also regulated by what we call baroreceptors. So baroreceptors, it is located in carotid sinuses or aortic arch. So this carotid sinuses or aortic arch, they regulate blood pressure. If the blood pressure, they convey or they transmit the information to sympathetic nervous system center in the medulla of the brain, Two, because increase the blood pressure. In central sympathetic nervous system, it is the one mechanism that lies up the blood pressure to increase, because its work as a fight or flight response, which will make the blood vessels to constrict as arterioles to constrict, and after being constricted, the blood pressure will be increased so that the peripheral distance will be reduced and the pressure will be increased. So when the blood pressure also drops, so the catecholamine will be released from the adrenal medulla, from adrenal gland. So this increases the heart rate and the vasoconstriction also. It not only sympathetic nervous system produced all catecholamine like epinephrine and norepinephrine, they produced from the adrenal medulla, that will cause the increase of the heart rate and the vasoconstriction of the arteries. So this will cause, to calculate the MAP, which is systolic blood pressure plus 2 times or 2 bracket of diastolic blood pressure divided by 3. After being divided by the calculate those equation, you will get if there is normal or abnormal. For example, when you take systolic blood pressure, which is 120 millimeter mercury, and 80 diastolic, you will take 120 plus 2 times 80, which divided by 3. After getting there, you will get result like 80 millimeter mercury, which is what we call the result from the pressure, result from the blood pressure. So the kidney also, it regulates blood pressure by the releasing the renin, which that renin it is needed to convert angiotensin 2 to angiotensin 2. This angiotensin 2, it causes aldosterone to be produced. After being produced, this aldosterone from adrenal cortex, it causes sodium and water retention. So this sodium and water retention will increase the blood volume, which will help the blood pressure to increase. And if the blood volume increase, also blood pressure, it will also increase. So other one, depending from there, regardless to the blood volume, their blood pressure cannot be maintaining. So that's why you have to see the blood pressure. Also, you have to see the blood volume, you have to see cardiac pump, and also you have to see effective vasculature. So if the one among those three is damaged, other one can work and compensate if there is not severe. So among them, after seeing the blood pressure regulation, by summary, blood pressure regulation, it is regulated by the baroreceptors, which will convey information to the sympathetic nervous system in the medulla of the brain. And also there is what we call catecholamine releasing, which will also increase the heart rate and the vasoconstriction. And also the third one, it is just releasing of the renin from the kidney, which ends up production of the aldosterone and retention of sodium and water, which will increase the cell blood pressures and restore the blood pressure. So by end up there, we can see what we call the stage of the shock. Stage of the shock, there is three main, which is the first is compensatory shock. The second one, it is a progressive shock, and the third one is irreversible shock. So starting from the compensatory shock is the first stage of the shock where the body can compensate from that shock and restore the normal body function. So suppose that the blood pressure drops of the patient, it drops. After being it drops, the body recognizes there is a blood pressure, it drops, and the release of the those catecholamines, adrenaline, and catecholamine like epinephrine and epinephrine. There is sympathetic nervous system. There is a release of the aldosterone, whatever. So those it support to increase the blood pressure and the storing this function of the normal cells. So, but this, according to the clinical manifestation of the first stage, so even if the body can survive from it, also they can also have the clinical sign and symptom, which is not severe. So when the blood pressure drops, means there is low oxygen and no nutrients. So then it causes having high metabolic acidosis due to the high use of the anaerobic metabolism. And those metabolism having metabolic acidosis, so will cause mental status to change. So if the mental status change, we will be having the what we call confusion, competitiveness, and others. So those can be characterized by the compensatory shock, but those one can take in a short period of time because the body it tries to restore itself. And also, if it become continue, you can give the patient, you can manage the patient by giving her or him the IV fluid, which will restore the blood volume and increase the blood vessels, and increase the blood pressure. Sorry, and also we just get supporting him about the nutrition, about the if there is low oxygen, you can put him on oxygen therapy, so that the patient can be done in normal condition. But what we call the progressive stage, this is blood pressure is no longer compensatory. If the blood pressure is not compensated by the body, it become called the progressive stage. So means the blood pressure, systolic blood pressure, is drops 90 millimeter mercury. So this the one who told about this one, it is Abraham et al. 2000. So about the pathophysiology, how this can be occur. So about this, the all organ, when there is no oxygen, they suffer from the oxygen and their nutrients. So if they suffer from the nutrients, firstly, they become dysfunctional of the body, where the body is not able to meet with the needed oxygen. So this will let cause what we call ischemia. So if there is ischemia, they will be followed by the cyanosis and hypoxemia and hypoxia. So those low of oxygen in the body. So this will cause myocardial depression. Other thing, this is not leading to the cardiac failure and is not caused by the cardiac disease. It is due to the blood volume, which is low. So the cardiac or heart is able to pump those blood, but those blood does not contain inadequate oxygen. That's why cardiac is not having the it is not participating in causing this high blood pressure, this shock. So the second one, out of regulatory function, this is the second one, micro circulation fails, or microcirculation fails to. They fail to pump this blood due to the secretion numerous by mediators released by the cells, and that from the increasing of the cardiac permeability with arterial and venous. So the result from the patient progressive worsens, and the excretion of the capillary sphincters cause the fluid leak from the capillaries, creating interstitial edema, return to less fluid to the heart. Even if the shock is reversed, the breakdown the vessels is remaining a problem. So about this progressive shock, this can be due to the having the infection in the blood vessels, This pressure in the blood vessels causes the release of the biochemicals, biomediators. Those mediators can be there and cause the breaking down of the blood vessels. Even if those can be restored, but blood vessels being broken down, so it can be remain as the problem. So this an assessment or the clinical manifestation. So by chance the patient can survive according to the patient health status before having a shock. Because so if the patient body have ability to work and to fight against those infections, the body can be restored and the shock will be reduced and resolved. But what is the clinical manifestation about the difference system, like respiration effect? So from here, if there is low blood pressure and low blood volume, so what means to the respiratory? So means there is low perfusion in the lungs, low blood perfusion in the lung, so that the alveolus will be collapsed. They provide the production of the surfactant, which help for relaxation and of the lungs and expansion of the lungs, so will be reduced and the alveoli being collapsed. After being collapsed, there is edema which is be found in the lungs, which cause the having the pulmonary edema. So after having the pulmonary edema, also they will have to call hypoxia, because there is no adequate gas exchange found in the lungs, and also there is a production of the glucose or wheezing can be there due to the fluid that can be deposited on the lungs. So those are different signs and symptoms you will see about the patient having those pulmonary edema, having the hypoxia, having the wheezing, having those clinical manifestations. About the cardiovascular system, the patient may complain having the chest pain. After having that, can be from the myocardial infarction if it become the severe and high heart rate. Yes, which can be approximately 150 blood pressure per minute. So it is what we call cardiac enzyme like lactase dehydrogenase will be increased due to having the hypoxia, you having the low blood containing oxygen. So in a nervous system or neurological system, there is decreased cerebral functions. There is lack of confusion. There is a confusion due to the having low oxygen and the nutrients as it's there. If they continue to be reduced, the people will be delayed as the result of having low oxygen and nutrients. So about the renal, if there is the low blood pressure or low blood volume reaching to the renal system, when blood pressure is below, is at 10 millimeter mercury, so glomerular filtrating rate also will be damaged, and which will lead to having the acute kidney injury can be there, and also this will be increasing the creatinine in the blood, and also creatinine in the blood, so it will just cause of the acid base balance failure due to the having the patient will have the sign of the metabolic acidosis. So this will cause urine cardiac output being reduced below the 0.5 per milliliter per hour. So or which is having cardiac urine output, urine output which is below 3 or 30 milliliter per hour. So about the hepatic effect, so if the liver is affected, so the way of the metabolic process about there is lack of the metabolism. The patient cannot metabolize the like oral medications, which can be led to the having the inadequate dosage taking during about the disease. So liver enzymes will be increasing due to having the high metabolic acidosis. So this will be increase of the toxic substance in the blood, which may lead to the damage of brain and become uh, having serious condition. So in GIT, there is lack of the blood saturating in the gastrointestinal system, so which is related to the having the people having craving about the chest pain from the stomach. A patient may have the ulcers in the stomach due to the low of the blood supply there. In the small intestine, it becomes severe. There is lack of the oxygen supplying in the small intestine, means it will become necrotic. Even large intestine can become necrotic. So there is diarrhea due to there is no absorption of the nutrients. So about the hematologic, those lack of the blood, those lack of the hypotension, those sluggish, these blood flows, low blood flows, it will affect or impair normal hematological mechanism. So that's why the blood also will be reduced. Maybe it can rise of the what we call ecchymosis can be produced, can be raised there, or bruise, and bleeding it can be appeared under the skin. So the medical management, you can just manage about this condition by giving IV fluid. IV fluid can be help about the replacement of the lost fluid, then and supporting the nutrition, and just supporting the cardiac, and supporting of the oxygen therapy because oxygen is low, and nutritional, and giving antihistamine because to reduce the inflammation. So about nursing management, you will just monitor the patient and administration of the medication prescribed in the correct dose, and also have to perform the ABG analysis and get and those can help having some information about the way of the collecting those type of the shock. So and also you have to maintain urine output. So about the prevent the condition, you have to detect this condition in early stage. In early stage, because the complication, if it becomes irreversible, the patient cannot return in normal condition. So that's why. So about the third stage, which we call the irreversible. Irreversible, this is the third stage of the shock where the patient is no longer responsive to the medication of the shock. Like if the patient having the irreversible, you cannot give them the IV fluid and having the end response. There is no, because the different organ become damaged, like liver, blood vessels, gastrointestinal, neurological, both they are becoming distracted, and after being damaged, so the body cannot perform those use of the IV fluid. So, but even about this one, the irreversible, it is where multiple organ dysfunction takes, because different liver become damaged, cardiac become damaged, the renal system become damaged, all the different systems found in the body become damaged. So that's why you cannot respond. But sometimes you can give in management because you cannot let patient to die without doing anything. You can give the IV fluid, you can to see what there is change, and also you can give the medication, the vasoactive medication, like giving and sympathomimetics, which can be help the patient to have to increase the heart rate of the patient, and those. So for patients who have suffering from the shock, which is irreversible, also you can give the antibiotics just to reduce the infection found in the body. If there is there, have to perform the FBC to see what is the level of the blood as the investigation, and see to perform the ABG analysis as the second, the third, the management, and also to inform the patient and inform the family members what is the status of the patient. So about the overall treatment of the shock, the firstly, step by step, you have, if you are healthcare providers, first you have to perform IV line to give the patient IV fluid. So this IV fluid is classified as, you can give them crystalloid according to the status of the patient. Also, you can give the colloids, which are according to the status of the patient. So by crystalloid, the explanation is those fluids that can move freely in different compartments. The normal or the more effective crystalloid, it is isotonic crystalloids like normal saline, where there is the isotonic, their electrolyte concentration, they occur in the extracellular or interstitial fluid space, and also the volume remain in the intracellular space. So this it remain in intravascular space. So this will be restore the volume of the blood. So, and also colloids, those are the large one which can be administered to the patient according to the status of the patient. So, but the preferred one is to give the normal saline or laryngeal lactate when there is a patient having the low level of electrolytes. So it depends on the lab result and the patient condition status. So then other second therapy is the vasoactive medications. You have to administer the vasoactive medication. This vasoactive medication, there is medications for giving alpha adrenergic receptor and beta and adrenergic receptors. So for this adrenergic receptor, you can give the about the in beta adrenergic receptor, there is a beta 1 and beta 2. So you can give the symptomatic medication like aminoin, even dobutamine, even dopamine, even epinephrine. So this also they can help patient have the heart contraction, but this can be cause the disadvantage of low oxygen demand. That's why patient may have oxygen therapy. In the vasodilation, there is what we call nitroglycerin, and also in vasoconstriction, there is norepinephrine and the phenylephrine and the vasopressin. So this vasopressin, they cause the vasoconstriction of the blood vessels of the arteries. So, and also there is the fourth one, the third one is the oxygen therapy, and they having the health education and nutritional status of the patient. So, okay, if you found this video is helpful, don't forget like, share and subscribe to our channel. Turn on the notification bell so you never miss our next lesson. Thank you for watching, and I will see you in next video.